Welcome to Infectious Disease Lesson 1.2, How Infectious Disease Has Molded History, including ours. The goals of this lesson are to illustrate the range of impacts that infectious diseases had in history, and relate historical impacts of infectious diseases to current epidemics. At the end of the lesson, the students should be able to list a number of globally significant infectious diseases and explain how they impact mortality, explain the societal effects of infectious diseases, and apply what they have learned today to explain the consequences of the HIV epidemic in Africa. We will achieve our goals by investigating the impact and prevalence of infectious diseases today using a web-based application, the Poudwaddle Clock. This will be followed by a brief discussion of infectious disease epidemics that shape the course of history. To prepare for this lesson, you'll need to review the following key scientific concepts. Epidemics have molded history by impacting economics, life expectancy, and the outcomes of war. And epidemics that are currently shaping history include tuberculosis, HIV/AIDS, and malaria. You can review the scientific content in the background reading provided for you in the teacher primer, the teacher manual, and the student workbook. The teacher primer provides in-depth knowledge about the scientific content presented in this lesson. The teacher manual, or lesson plan, provides a minute-by-minute explanation of the lesson structure. And the student workbook provides additional explanations for students. Note that there is an annotated version available for teachers. Be sure to print the lesson worksheet and the homework worksheet, which are both located in the Lesson 1.2 Curriculum Materials folder. This lesson also requires access to the internet. The Poudwaddle Clock activity works best if students can access it individually or in small groups, but if your classroom has limited technology, you can also run it as a demonstration. It can be accessed through smartphones. The key point of the lessons due now is to create a list of globally significant infectious diseases. We'll get there by having students review homework with a partner. The do now begins by creating a list of globally significant infectious diseases based on the students' research in the Lesson 1.1 homework. On a board, create a list that includes the name of the disease, whether it is caused by a virus, a bacteria, or a parasite, and the source used to determine its global significance. Make sure students used reputable sources to obtain their data. Use of reputable sources will be important when students begin to research their final project. Make sure that the list includes AIDS, tuberculosis, and malaria, which will be the focus of the Poudwaddle Clock activity. The key points of the lesson's activity are that current prevalence of infection and mortality will be higher than most students expect, and accuracy of an estimate can be calculated using percent error. We'll get there by checking estimates of prevalence on the Poudwaddle Clock and then by calculating accuracy using percent error. Before opening the Poudwaddle Clock, have the students estimate how many people have died since January this year from or are infected with TB, HIV, and malaria. You may need to briefly introduce TB, HIV, and malaria and diarrheal diseases first. Some teachers also find it easier to have students rank the diseases in order of prevalence rather than to have students estimate the actual number of deaths or infections. You will need the internet to access the Poudwaddle Clock. Familiarize yourself with the clock before class. After the students complete their estimates, they use the clock to compare them with the actual prevalence of the diseases. It's important to note that the clock resets every January, so it only shows the impact of the infectious disease from the beginning of this calendar year. The clock is updated regularly. Once you have opened the clock, navigate to the Health Clock. From the Health Clock, select by infectious disease to view current disease statistics. The key points of the lesson's discussion are that epidemics have molded history by impacting economics, life expectancy, and the outcomes of war. Interventions can alter the course of epidemics. We'll get there with the lecture and Socratic discussion. The next few slides illustrate how infectious disease epidemics have influenced the course of history. Before class, familiarize yourself with the detailed account of each epidemic in the lesson manual. The Antonine Plague was either smallpox or measles and led to a dramatic decrease in the population of Rome. This weakened the army and slowed the expansion of the Roman Empire. The bubonic plague, or the Black Death, killed approximately half the population of Europe in the 14th century. This outbreak of the bubonic plague was one of the deadliest pandemics the world has ever experienced. The Black Death plague mask was worn by plague doctors during the Black Death. People appreciated that Black Death could be transmitted, but at the time, infectious agents had not been discovered, so people believed that the mask acted to draw the disease out of the sufferer. When Christopher Columbus carried smallpox and measles to America, these diseases killed millions of indigenous people, greatly weakening the Native American armies. Columbus also took syphilis back to Europe. Lord Geoffrey Amherst, an English soldier, is thought to have intentionally used smallpox-infected blankets as bioterrorism agents in the war against the Native Americans. It is sometimes hard for students to imagine that epidemics are still shaping history. One example is HIV. Use the map of HIV prevalence to highlight the social and economic impacts HIV has on the communities it infects, and discuss the importance of prevention and treatment. This is covered in the lesson plan. The key points of the lesson's homework are that infectious diseases impact our everyday lives and behavior, and we have developed a number of daily habits that prevent transmission. We'll get there by having students list 4 to 5 behaviors to avoid transmission. One of the most common questions students have is, why does the rate of HIV infections vary so much among African countries? One main difference is in the governmental policies for prevention, education, and treatment. At the end of the lesson, you will collect the lesson worksheets to assess students' estimates and percent error calculations from the Poodwaddle activity. This lesson highlights the ongoing life relevance of infectious diseases that we will continue to explore throughout the module. Don't forget, if you have any questions, concerns, or feedback, to let us know. You can contact any of the CTSE team members and we'll be happy to help you.